Good afternoon, and thank you for joining us for this community briefing on COVID-19. Joining me again today is interpreter Margie Propp, and we're so grateful for her service. Thank you, Margie, for making our briefing more accessible. And to keep one another safe and to access information and the latest resources available to support our community during this pandemic, we encourage everyone to please visit our website at covid19.lincoln.ne.gov. There you'll find the latest information as well as a dashboard providing COVID-19 data for Lincoln and Lancaster County. We update that dashboard daily at about this time. You'll also find our COVID-19 risk dial, a color-coded tool that gives our residents an indication of the level of risk for community spread of COVID-19 here in Lincoln and Lancaster County. We updated that dial Friday, and we remain in the low orange section of the dial. Orange indicates a high risk of spread of COVID-19. We encourage everyone in Lincoln to stay faithful to the common sense practices that prevent the spread of COVID-19. Wear a mask, wash your hands, and watch your distance, keeping 6 feet from others. And minimize your trips outside the home, leaving for work, school, medical care, groceries, or exercise. In today's situational update, an additional 15 people in our community have tested positive for COVID-19. The total number of lab-confirmed cases now stands at 3,501. Our total recoveries identified to date are up from 1,614 to 1,628. Health Director Pat Lopez is here with more details.
Thank you, Mayor. As the Mayor noted, our COVID-19 risk dial remains in low orange, but we continue to move closer to the yellow level, which indicates a moderate level of risk for the spread of the virus. In determining the position of the dial, we look at the data from the past 3 weeks, and we now have 3 weeks of data showing improvement in most areas. The number of new cases per week has dropped from 56% in the last 3 weeks from a high of 360 cases a week ending July 25th to just 158 cases for the week ending August 15th. The average week positivity rate has been trending down and leveling off. The rate went from a high of 8.3% the week ending July 25th down to 5.6% the week ending August 15th. Over 52,000 Lancaster County residents now have been tested, and testing remains widely available in the community. While we are not at the desired 24-hour standard, the turnaround time for test results is improving. Over the last 3 weeks, 76% of the testing results have been received within 3 days or less. Again, lab turnaround time is an issue over which the health department has no control, but it is extremely important to our efforts to slow the spread of COVID-19. Delays in receiving lab test results slow our follow-up with people who have tested positive. They also slow the start of our contact tracing, which is essential for preventing outbreaks and clusters. To help people understand where they can expect to receive the fastest turnaround times, we have added a new line graph to the dashboard to illustrate the turnaround times for a variety of labs. As you can see, most of the labs have turned around times of 2 to 4 days. The purple line represents Quest Lab, which is being used primarily by CVS and MedExpress in Lincoln. As you can see, Quest still has a poor turnaround time of nearly 6 days. This is an unacceptable time length, which makes the testing almost worthless in terms of preventing the spread of the virus. After people get tested, they must quarantine until they get their results. Staying home from work for 6 days while awaiting results potentially causes economic hardship for the person being tested. And if the person tests positive, our contact tracers have lost a week in their efforts to identify and quarantine the person's closest contacts who have been exposed. In other words, the virus gets a week's head start in spreading throughout our community. To avoid such problems, we urge people to use the testing services that do have quick turnaround times. If you want or need to get a test, You start the process with an online risk assessment at bryanhealth.com, chihealth.com, or testnebraska.com. You do need to follow this process to get an appointment. As a reminder, Test Nebraska is now testing 6 days a week, and that service is free with no billing to insurance. And the health department continues to work with our local businesses to provide guidance and help them with mitigation strategies to best protect their employees and customers. With college students back in Lincoln, we are particularly concerned about businesses where students are likely to gather in indoor spaces, like restaurants and bars close to campus. The CDC tells us that shared living spaces like dorms, sororities, and fraternities are also concerns for transmission of the virus. The fact is that if students fail to wear face masks and don't stay at least 6 feet from others, it will be a challenge to keep the virus under control with students and in our wider community. Well, we have scheduled a Zoom meeting with the downtown area bar owners and managers to discuss our concerns and to work with them on following the directed health measure. We have a common goal: to keep businesses open while keeping employees and the public safe. Businesses do have the responsibility to manage the safety of their establishments, but all of us, including college students, need to take the simple but necessary steps to keep ourselves and others safe. We have some great examples of businesses that are doing that right. The management of Sandy's Bar downtown, for instance, has implemented guidance from the health department. Their staff follow the health measures, and they are continually educating their customers on how to stay safe. The more we can work together like this, the safer our community will be, and the sooner we can move forward. Being divisive and uncooperative with staff sets our whole community back. Colleges have done a great job of communicating expectation and requirements for students, faculty, and staff to follow on campus, including wearing masks, maintaining proper physical distance, and limiting social gatherings. We are asking students to do to follow those rules outside of the classroom and off campus as well. The choices that students make may have a dramatic impact on the progress Lincoln has been making in the past few weeks.
Thank you, Director Lopez. While our health team works around the clock to respond to the immediate demands of the pandemic, they also keep an eye on the horizon. So while they have their hands full fighting COVID-19, they are also preparing to battle with influenza. What's normally thought of as flu season in the U.S. doesn't really begin until October and usually peaks between December and February. But because of the pandemic, now is the time for all of us to start thinking about when, how, and where we will get immunized against the flu this year. To have the best chance at achieving immunity throughout the flu season, September and October are the best times to get vaccinated, although getting a flu shot later is better than not at all. The health department is convening a vaccine task force to help coordinate our local efforts to vaccinate for the flu and hopefully for COVID-19 as well, if scientists succeed in developing a COVID-19 vaccine. The flu and COVID-19 share similar symptoms, including fever, chills, cough, sore throat, muscle and body aches, headaches, and fatigue. One symptom that differentiates the two is the loss of taste and smell, which can happen with COVID-19, but does not occur with the flu. The flu can be dangerous on its own, of course, hospitalizing and killing tens of thousands of people each year and sidelining millions from work for days to weeks. People who can avoid the flu will help reduce the burden on our healthcare system that will already house COVID-19 patients. Emergency rooms and urgent care clinics are often flooded with flu patients during winter months, so getting a flu shot can help prevent those visits and prevent the commingling of flu patients and COVID-19 patients who may infect one another. While the dangers we may face in a time of year when influenza and COVID are spreading concurrently should motivate all of us to get our flu shots, it's heartening to learn from the experience of countries in the Southern Hemisphere They've been enduring flu season while we've had summer these past few months, and their experiences suggest that we have some reasons to be cautiously optimistic. The Wall Street Journal has reported that countries including Argentina, South Africa, and New Zealand are seeing below average flu infections this year, likely owing to the fact that their people are following those common sense steps to prevent the spread of COVID-19. They're washing their hands, they're wearing masks, and they're watching their distance, keeping 6 feet between themselves and others. And those steps are helping to prevent the spread of influenza, too. We will be sharing more information about flu vaccinations in the coming weeks, so stay tuned and start making your plans now. And as we wrap up this briefing, we'd like to take a moment to acknowledge that August 18th marks the 100th anniversary of the 19th Amendment, which ratified women's right to vote. Today, we celebrate those early steps toward American women's full civic participation, and we recognize that it would be years to come before women of every race gained full access to the voting booth. We honor all those throughout our nation's history who have fought for and defended the right to vote for every American citizen. And finally, today is another Sunshine Tuesday. We have more children's art to share with you. Through the Sunshine Kids for Seniors project, children of all ages are invited to write a note or create a colorful card. We will email their masterpieces to sunshinekids@lincoln.ne.gov. We will then share their creations with homebound seniors who really appreciate their efforts. And with that, we'll open it up for questions. Any questions from the media?
This is Chris Dunker from the Journal Star. I have a question for Pat.
You bet. She'll be right here.
Hi, Chris.
Hi, Pat. Are you able to do contact tracing as quickly, now that if a case happens at the university, and there's potentially hundreds, if not thousands of contacts that a student would have, can you adequately or, contact trace and figure out who might all have been exposed to that individual?
Yes, and we've been working really closely with the university, both campus and athletics, probably since late April, early May. And just so you know, Chris, we've been doing contact tracing since the beginning of the COVID outbreak. There have been students on campus that have tested positive. So we've been able to have experience doing that. We actually have a system set up to be able to do that and do it quickly, and for identification of the close contacts of those individuals.
And while I have you there, do you have a comment about your appointment becoming official as health director today?
Well, I'm looking forward to meeting with the Board of Health this evening, and I'm looking forward to moving on and focusing on what we need to do to keep our community safe.
Hi, this is Margaret from the Journal Star. I have a question for Pat. I'm sorry, come back.
That's okay. Hi, Margaret.
I have a couple of questions. One is, if you could talk to me, explain a little bit about who should be notified when there's a positive case in schools. How specific does it, how should it be and why? Should you just know if somebody in your school has a contact, or should the class know, how important is that?
Okay. Generally, what's happening with the schools is that we know when there's a student in a class, if there is another sibling, we have a contact person, whether it's a nurse or in other schools, it can be another individual that we work with directly. And we are doing weekly calls with the schools to just keep in touch right now as we're back. But the classroom will know, and if they're all wearing masks, we'll be monitoring all of them. And their parents will know that, the parents of students in that class will know that there's monitoring going on and there's been a child who's tested positive.
So it will be the class, not just the school,
Right,
who's notified if
Right.
there's a positive case?
right.
Okay. Also, can you define what a high-risk contact is? How do you define that?
Well, it's a situation where you're in close contact for 15 to 20 minutes, and neither person is wearing a mask, and you're symptomatic.
Okay, so if, say in a school setting, if there's two kids sitting at one table and one is symptomatic, if they're both wearing masks, even if they're not 6 feet apart, it wouldn't be a high-risk contact?
How we're doing that right now is we're monitoring those students. If you look at some of the materials provided by the Department of Health and Human Services, those are considered, when you're wearing a mask and I'm wearing a mask, that's considered a low risk. And even though they may be closer, and the schools are doing everything they can to maximize students being apart. Some school systems are able to actually move students 6 feet apart in the classroom, but not all schools can do that. And some schools have added more portables to reduce density in the classrooms.
Thanks.
Yeah, and also, we worked with the school so they don't have students facing each other. Everybody's facing the same direction and also distanced apart as well. Our schools have done a tremendous job of trying to make sure our students are as safe as possible.
This is Bill with 1011. Just a question about testing numbers. You know, I know in mid-July, Lancaster County was averaging between 600 and 700 a week, and that has fallen fairly significantly. Can you attribute that to anything?
You know, we're not quite sure why, but we do know that a lot of individuals are getting in that are symptomatic, because we know the numbers going into the drive-in sites for sure. Test Nebraska is down some, but we're probably going to see a rise in that. And also the University of Nebraska has a testing site for Test Nebraska now on campus that opened up, I believe, Friday or Thursday. And they'll have 3 hours of testing every day except Sundays for students and faculty and administrative staff.
I know that a month ago you told us asymptomatic cases only made up about 11% of the total. Do you know if that is still true?
You know, Bill, I'm not sure. I'd have to look at that, so I don't want to say something that's not true. So I'll check it out.
Testing. There is still plenty of capacity at all
Yes.
sites, correct?
Yes, and so we really want anybody who wants a test to get a test. And if, you know, Test Nebraska's got plenty of space to take more in.
Any other questions? Right, well,
Mayor, this is Bill. I have just a quick question about Interim Director Lopez. When that approval likely goes through tonight, one, is it going to affect immediately? And two, is there a term or a length for that contract, or how or when would we, Mrs. Lopez, leave if she ever chooses to do so?
let's see, let me see if I can answer your questions. I believe that it does go into effect immediately, but I'll have to confirm that for you, Bill. And then currently, as a consultant, she has been on a contract, but if she is made permanent, then she would no longer be on a contract. She would just be a permanent hire with no end date that's identified.
That answers it. Thank you.
Okay, thank you. Any other questions?
Yeah, Chris from the Journal Star with another question. Do the totals from the testing sites at UNL on campus, do those roll into the wider county testing results?
I'll let Director Lopez come up and answer that question for you, Chris.
Chris, those results will come into Lincoln for the students, and we do the follow-up. So those numbers will come into us at Lincoln Lancaster County Health Department. The same, the university, Westland, Southeast, all of those come in because we're actually the ones that do the case investigation and the contact tracing. So the numbers will come here, even though they may have a permanent address that's in another state or another community in Nebraska, but their residence is considered here, and that's where their contacts are.
And so will those figures be part of the broader total, or will they be broken out to say, here's the UNL testing, or here's the Wesleyan testing, whatever the case might be?
No, they'll just be part of the broader total, but we're working with the higher education to see how they will be able to share that information for their campuses.
Any further questions from the media? All right. If not, thank you all for joining us today, and thank you for wearing your masks and washing your hands and watching your distance to protect your friends, your family, and your neighbors from COVID-19. Your concern and care for others will get us through. Thank you.